This is our title. The are not necessarily formalized in the mathematical language. We hypothesize an analogy between the Jung concept of algorithm and the concept of the complex. The complex is a concept of Jungian theory, often called psychic theory of complex. The complex are maternal, paternal, and fraternal. For Jung, the complex is a set of images united by a strong central affective tonality. And for Jung, the complex is the royal road to the unconscious, is not constituted by dreams of reassociation, but precisely by the complex. Last but not least, the element of affinity between complex and algorithm is the strong central affective tone of the first, which coincide with the communicative interactive theme of the algorithm. This concept can be amplified by Luborsky's concept of the CCRT, that means core conflictual relationship themes, whose essential components are the wishes and the expectation of the subject. In a Jungian psychotherapy perspective, it is important also consider the communicative orientation, a form of brief psychodynamic psychotherapy combined with a psychological analytical communicative orientation. It seems important to define that brief psychodynamic psychotherapy represents one of the psychotherapy's empirically supported and treats. Moreover, a consensus conference of the Italian Institute of Health System identified brief psychodynamic psychotherapy together with cognitive and behavioral therapy and interpersonal therapy as the only exclusive psychotherapies based on the highest level of efficacy for common mental disorders or common emotional disorder. That brief psychodynamic psychotherapy, in our opinion, defines the duration of the treatment in 16 sessions, agreed at the beginning with the patient, and identified the core conflictual relationship theme as the method of the clinical approach. With these premises, we will illustrate a clinical cases with particular attention to the fraternal complex. In recent years, psychoanalysis has witnessed a significant revival of interest in the problem of this fraternal dynamics. The clinical case. We speak of a fraternal complex where the unconscious intrapsychic moral conflict is present. The patient, a 31-year woman, demonstrated both high-level defense, such as anxiety, and low-level defenses against awareness of this conflict, such as polyvagal and psychosomatic defensive reaction, such as headache, stomachache, enlarged gland, skin rash, fainting reaction. The stimulus event at the beginning of this analysis is a stressor external to the patient, and here we use the term in the meaning adopted for the Luborsky CCRT, which does not take into account the possible presence at the basis of the patient's symptoms of an unconscious intrapsychic conflict determined by his ambivalence toward her sister, loved and hated at the same time. She also attributed psychic strength and aggression to her sister. It is obviously a matter of a force which is the expression of an hypomanic attitude of denial of the event. In the context of the complex that has been studied with the stimulus event, the patient nourished strong self-image. The image of the mother is distressed by a state of alarm, affected by a sense of helplessness and despair. Why did it happen to your sister? The patient linked her symptoms, anguish, to an experience that was unleashed in its virulence both by the awareness of her sister's illness and by the period in which she accompanied her to the hospital, seen as a cold. Hospital therefore attacked as the symbolic equivalent of a mother who responds to the desire for warmth and affection in a cold and negligent way. The defense used was the mechanism of avoiding the sister illness, topic generator of pain, displeasure, and malice in her. When the therapist connected this pain, which the patient can experience only at bodily level, with her physical symptoms, the patient could finally allow herself to experience of her tears, for example, mourning. Following this experience of pain, she questioned a sense of autonomy and independence related to her professional efficacy, which, however, were accompanied by a feeling of loneliness caused by the spatial distance from her boyfriend. Before her sister's illness, she felt very strong, no less so. She projected onto her sister a latent aggression toward the possibility that the latter would undertake a possible profession that impulse not to work and study anymore, which for the first time she began to feel recently. However, she had a reaction to her sister's illness because she dreamed of her dog in a garden full of flowers and light, similar at her, that is an unconscious instinct for life and the light of truth. It is the only positive element in a sea of pain and suffering related to the related anxiety. In conclusion, the analysis conducted with brief psychodynamic psychotherapy with a Jungian communicative orientation of the complex, while revealing a development that started from the recognition of this in the patient. The fraternal complex are rediscovered, its healthy functionally in the process of acquisition by the patient of the ability to experience and to possess the reading key or her positive and negative feeling, no longer polarized as opposites, but dissolved by a synthesis that has driven the patient at higher dimensional level of her personality. Thanks for your attention.